Regarding dressings, dressing create a barrier which avoids contamination and absorb exudates. Normal dry skin contains about 1000 bacteria per gram. Skin is exposed in moist area has 100,000 bacteria per gram. Classification can be permeable or non-permeable to water and oxygen. Different types. First is Sorsban and Keltostat. They are ropes or ribbons, and they are used in exudating fluid derived from seaweed. Then is Intracite. It's a hydrogel. It absorbs slough and exudate. It uses secondary foam dressing and retain moisture. It comes in sheet. Gelunet. It reduces adhesion in granulation tissue and can be a transport medium for skin graft. Tegaderm and Opside, non-adherent, allow passage of moist vapor and oxygen, but impermeable to water. Aquacell, this is like a gel. It's sealed and create acidic environment and hypoxic environment, so reduce ingrowth. It transforms material into gel and it traps bacteria and exudates. Melonin, it is just like a Primapore dressing. It has alginate in it. Enadine, it has iodine in it. Surgicel, it is like a hemostat. Actually, it's an oxidized cellulose polymer. Surgiflow, this is like an injection. It is a hemostatic matrix with thrombin, and this accelerates formation of platelet fibrin clot. Then is larva therapy or maggot therapy, which is just debridement or dissolving necrotic tissue. Then is a vac therapy, which is called vacuum assisted closure. It is a negative suction. Normally it should be minus 50 to 100 mmHg, commonly 125 mmHg, and helps to close the wound, incisional wounds. Pico is a negative pressure, absorbs fluid from the into the dressing. Regarding Wolf trial, negative pressure effect versus standard therapy, treatment was assessed up till 12 months in severe open fractures, show no improvement while we use VAC therapy. It doesn't improve deep surgical site infection or quality life in 12 months. WIST trial does not support negative pressure therapy in incisional wound treatment.